Please come to order. Good afternoon. Welcome to the Commissioners of St. Mary's County. This meeting, October 26, 2021. I am Randy Guy, President Commissioner of St. Mary's County. I'd like to introduce the other commissioners. Sitting to my right, representing the 1st Commissioner District, which includes Ridge, Piney Point, St. George Island, Mr. Eric Colvin.
Good afternoon.
Mike Hewitt, who represents the 2nd Commissioner District, which includes Leonardtown, Hollywood, is sitting to the end of the table here. I got unable to attend. Anyway.
I'm here today.
You're here today.
Good afternoon.
Sitting to my left, representing the 3rd Commissioner District, which includes Charlotte Hall, 7th District, Golden Beach, and Mechanicsville, Mr. John O'Connor.
Good afternoon.
Representing the 4th Commissioner District, which includes Lexington Park, some of California, Great Mills, and some of Hollywood, Mr. Todd Morgan. Dr. Rebecca Bridget, our County Administrator, is sitting at the table to my left.
Good afternoon.
Elisa Cassis, our Communications Director, is sitting at the table to my right.
Good afternoon.
Amy Carter, our Video Media Producer, is behind the glass. Please turn your cell phones off or on vibrate. When you come to the presenters table, please come down the center aisle. And remember, this meeting is being televised, so you need to speak clearly and directly into the microphone for recording purposes. At this time, we please all stand for who's got it?
Dear Lord, thank you for this beautiful weather. Thank you for this beautiful day. Thank you for all these people we serve. And please give us the wisdom to make the right decisions and the courage to follow through. And all this in your name. Amen. Please join me in the pledge. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Commissioner Hewitt. I suppose next we need the consent agenda.
So moved.
Second.
I have a first and second. All in favor? Aye. Any opposed? Ayes have it. At this time, we need to go right into County Administrator time.
Thank you, Commissioner President Guy. Commissioners, we start with the draft meeting agendas. So on November 2nd, you begin your morning via Zoom with the Commissioners of St. Mary's County and the St. Mary's County Metropolitan Commission joint meeting. You also have a proclamation that morning for Family Court Awareness Month. And you adjourn your morning business meeting and reconvene at 1:30 p.m. for a budget work session. You don't have a meeting scheduled for November 9th. The next draft meeting agenda is November 16th. You begin your morning with Citizens Academy recognition, and Department of Land Use and Growth Management has a public hearing at 9:15 for electrical code amendments. You have 2 proclamations scheduled, Giving Tuesday and the Great American Smokeout. You have your review with St. Mary's County Board of Health, a memorial ceremony for Dale Smith, and then a closed session to discuss litigation, real property, and legal advice. For today's business meeting, you begin with item B with the Department of Recreation and Parks to present the cooperative wildlife management agreements for Myrtle Point Park. Mr. Shepard, Director, presenting.
Thank you and good afternoon.
Again, how you doing?
Yeah, Commissioner, I'm looking for you to authorize this cooperative wildlife agreement there at Myrtle Point. We have 2 areas of hunting there that the DNR sponsors and operates on that property. One is for the wildlife, and it's about 85 acres. It's open for that, safe zones. They've been doing it for years. And then we also have some marked spots out there for the waterfowl that come in mostly off the boats, sometimes even from over in the Clark's Landing area. It's working well. It stays safe. We do have Myrtle Point sign-up sheets. They call them directly to get the permits through them. Park staff has alerted me that all is going well, and we don't have that many still, and it's bow hunting only, but I'm looking for you to authorize that existing lease agreement and renew it.
I move to approve the deer and waterfowl cooperative wildlife management agreements between the county and the Maryland Department of Natural Resources on behalf of the Department of Recreational Parks, and authorize the Commission President to execute the related documents.
Second.
I have a first and second. All in favor? Aye. Any opposed? Ayes have it.
Thank you very much.
Thank you, Commissioners. And item C is from the Department of Emergency Services with an animal shelter manager and mid-year position request. Mr. Walker presenting. Good afternoon.
Good afternoon, Commissioners. So we're moving along with our shelter. We're doing very well. It's great news. Looking very good down there. It's got the roof on and kind of getting excited about it. But we need to make our plans. We are on schedule to open up in July, we hope. The building will be done. We think it actually may be done a few weeks earlier, but I need 6 months from the time that I hire the shelter manager to the opening. So I'm coming to you requesting funding to be able to hire this person January 1st. If you approve this today, we will begin the selection process and have the person, we hope so anyway. We're going to work hard to do that, to have that person in place on January 1st. And the marching orders are going to be prepared to open July 1st. So my request is for you to approve the funding.
Have we figured out what we're going to do with, let's say, these volunteer organizations that want to be involved? Have we figured out that synergy that'll happen between our animal control people and the...
That's a great question, because we've been down this path many times, and you're hitting the, I was going to ask, thank you.
Well,
So you're talking about volunteers in the shelter?
yes.
To be honest with you, that is part of what this shelter manager is going to be helping to advising. They're going to be writing policy, they're going to be setting, they really are going to be the person that is going to lead us into that shelter. So it is a great question, but that is the person that I need to be doing that. I have no staff right now to devote to this project, none. They're absolutely consumed between emergency management, 911, and EMS, we know is a huge project. So I have to have this person. This person will begin to hire. This person will write policy. This person will tell us what we need to do. I will be right there supporting 100%, but I need somebody to devote to this project 100%.
I think,
Animal control people move out of where they are to this location?
They will, and they will come under this division manager. That will be a transfer over to that. That's been the plan from day one, but yes, they will move over.
I'm just
That
trying
will-
to make sure I remember what I remember.
Yes, and it will give us a bit more. We're starting to get a little bit more space, but it will give us a little bit more when they move over, so that'll be good too.
I think one of the things to consider is back when this started, when Commissioner Jarbo was here, it was a hope that it would be staffed with volunteers, but the realization is that that is not going to work based on what had happened, and that's why we have FTEs slated for the CIP, because staffing a 24/7 facility with animal control is not realistic with all volunteers. While I know the volunteer organizations are hoping to help fill in gaps, run programs, things like that.
They will.
The actual operations of the facility are not going to be done by actual volunteers. And I spoke to Dr. Bridget about it today, and I had a conversation with one of the members of the Animal Control Advisory Board. And I know Commissioner Guy has spoken to many boards about this as well, as what the role is advisory. So this position is key, because I told them once this person gets on board, they'll be able to work through that and come up with, the policies that then be recommended to the commissioners as to what is going to be adopted through emergency services. That the Animal Control Board does not set policy and/or ordinances, but there is a process that will be established with this key individual being there. And I think that's going to solve a lot of problems with the Animal Control Advisory Board as well.
This will go far to assist with that process, absolutely.
Yeah.
Okay, presently at the animal control shelter we have right now, we're in Hughesville. Do we have employees there that are St. Mary's County residents that are showing any desire to move down to ours?
I'm not sure I understand the question.
Well, the employees we have that are at the shelter there in Hughesville now, are any of them St. Mary's County residents, or have made any desire to come to ours once it's completed?
We just hired one of their employees
It's a good job. No,
as an animal control officer.
I know what qualifications some of them have, but I'm just wondering if there's any that's made any kind of...
It is one of our new employees that is just starting. They'll start on the 1st, and they live in St. Indigo's, drive to the shelter every day.
Okay.
And we've had actually 2 or 3 apply, but we picked up 1. We may pick up more, so yes.
Okay, all right. Good, that's good. I just want to make sure that we touch base with them, but those that somebody lives in St. Indigo's are probably glad to work in.
Absolutely, yes, and there will be more that are going to want to come down.
Okay, I just want to make sure we check on that.
Yep.
Okay. I have no other questions.
I move to approve the Department of Emergency Services mid-year request to hire one FTE animal shelter manager position effective January 1, 2022, and authorize the Commission President to sign any related documents.
Second.
I have a first and second. All in favor? Aye. Any opposed? Ayes have it.
Thank you so much.
Thank you, Mr. Walker.
Thank you, Commissioners. And next is an informational update from Mr. Walker on EMS staffing information. Mr. Walker?
Okay, so EMS. So we're doing very well in what we're doing. There are some lapses, but the lapses, I can tell you, are not due to what we are putting out for service. We're meeting what has been requested. We see some areas that we know there needs to be more service, more people out running ambulances, and advanced life support additionally. We've talked to the chief in the north end, the chief in the south end. They seem to think they can do it themselves, and that's fine, but it's their building, so, but we're doing well. So if you just take a look at some of these documents, I mean, page 2 is pretty much standard. You go to page 3 is a bit eye-opening. You see the third quarter average per month is 192. That's the highest, and it goes up 578,000. So it's increasing. If you look at this very nice chart that's come out of our EMS billing, you see that, percentage of career versus percentage of volunteer, in these categories, you've got the 7 district that shows a bit higher than we are. You got Ridge. For the most part, though, we're doing most of the running.
What percentage of calls, roughly, are career versus running?
I think a fair number with all of these is about 63, 64% is what we're running versus the volunteers. And again, that varies every month, but that's as of the last report.
So to clarify, you're saying that roughly 2/3 of the calls are being run by the career paid versus 1/3 being run by the volunteers?
Yes, sir.
Okay. Have we established a policy, or I know we've let individual departments do their own, of when volunteers run? Because I had heard from people saying that, they go in, they volunteer, when they get there, there's career there, and a call comes in, the career takes it, and they're like, hey, why am I here?
That's not accurate.
Good.
That's not.
So,
We will run it, but we don't set that. That's their choice. I mean, again, there are many times when the volunteers come in and then the career runs most of the calls. It's their choice.
Even though the volunteers are there, the career runs
Yeah,
most?
it's their choice. And again, I've told you before, I'm not going to set that on who's going to run it. I don't care who gets there. Whoever runs. The primary focus has been and will continue to be patient care and getting somebody to that person. I don't care who runs. But I can just tell you the reports I'm getting back from our career employees is that they go in, they run. Some of them are great. Some of them have great relationships. Others, not always the best. But it works, and we're making it work, and we're going to continue to make it work. And again, I've said the Emergency Services Board, we're not going to let this system fail, because our people in this community are the ones depending on it. So it works. Could it be smoother? I will tell you, it will get smoother and smoother and smoother as we go along. So,
Mr. Walker, I think, one, thank you for clarifying that, but I think that the statement that the career are just running the calls and the volunteers aren't, if you look at the volume of calls, or they're, whatever you want to call it, call hoarding, whatever you call it that, it can't be factual. Based on the amount of calls that the county has,
right,
based on the do not response rate, there's plenty of calls to go around. So whether it's a career or volunteer, there's not a lack of calls. So, I can understand if there was 30 calls for service and, that's all we had, but we're talking, what I saw here was 2,227 calls. So there's more than enough calls to go around for people to run. It's a matter of having the personnel there to run them. So whether the career is taking the first call or they're taking the second, there's no lack of the availability of providing the service.
correct.
The other question I have looking at the numbers. Now, I want to be very clear in this, that I know there's department scratching system-wide, okay? It's how it is. However, the mechanism that's in place is the second due, that the reason it's not having a negative impact on the system, or we're not getting the CAD printouts, is because it's only going to the second due, and then they're responding within the reasonable time and parameters set forth. The issue I have is in the north end of the county, in particular District 3, the scratch rates or do not respond rates are high, which is not providing the patient care that is there. For instance, Charles County the other day reached out and was concerned because we have a call off Laurel Ridge where Mechanicsville was maybe on another call or whatever. They didn't have an ambulance in service, whichever one it may be. They dispatched Hughesville, Benedict, Dentsville, Waldorf, La Plata, Belle Alton, and then added Newburgh. And Newburgh was finally the ambulance that responded. So what is going on in the north end of the county that we are not having more career staffing to provide the immediate services to our citizens?
So we've asked a couple of times to be able to put more personnel up there, and they feel they can do it on their own. So, they have to authorize that at this time. For me to place an ambulance in the north end, outside of that, I have to have a vehicle, which, our ambulance has now taken on the role of what the volunteers were doing. We're doing all of the vaccination sites, we're doing the fair, all of those events. So that is being used much, much more than we thought. So I need a vehicle, and I need a place to station them. There are some alternatives. I still would argue that you could find a storefront, and you could put an office and bunks in the back, and you could run calls out of that location, but you still need a vehicle. I have adjusted my American Recovery Act funding to address that when that comes up again, to try to buy an ambulance. That would be a second vehicle that would help us out. So it really comes down to resources. We need the staff, and we need the vehicles, and we need the locations to be able to put them out there.
But I think, while we talk about that on our side, and I think those are all amazing ideas, and to further develop the system, one, we spoke about dispatching protocols and fixing those so we're not going outside of the county immediately, and we're pushing inside of the county to use those resources. But aside from that, we have taxpayer-funded ambulances within St. Mary's County that are sitting there. So if we're not providing the service, or I would say the county as the system as a whole, what is the stop? What is holding you up? What is the one thing that is stopping you from getting career services to answer these calls that are not being answered? And they're serious calls. I mean, I have the emails, so.
So these rescue squads do a wonderful job, but they are separate entities. They are not governmental entities, and they control their resources. Yes, tax money goes to them, but they are independent, and we have no control over them. I'm not encouraging or saying we should have that, but that is what is stopping us from being able to use their facilities. They have to give approval for it. They have to give permission.
Okay.
Pure and simple, that's what it is.
So drilling down from what I'm hearing from you is that you've requested to Mechanicsville to utilize more resources in order to staff extra hours to answer the calls that are not going answered. That has been denied through one means or another, whether it's a voting or it's they feel they can do it, but the data shows otherwise, that it's not happening.
Correct.
Okay.
And there was one other, Luxett Park also. The same thing we've asked, because we see that the numbers are quite a bit higher. And again, I'm not trying to disparage anybody, but that's just the facts of where we are.
No, that's not the point of this conversation. The point is getting to a solution and understanding where the problem is and what can be done to solve it, to ensure that we're not getting these messages for citizens that are not getting ambulances. So hopefully you can come up with a plan and figure out how we can make that happen, because it's kind of disheartening that the north end of the county is the only one that I'm getting emails on that people aren't getting ambulances.
The only reason you don't get them in the south is because the resources that come when they fall short are from within the county,
Yeah.
because there are an equal amount of what we would call failures if they were coming from outside the county.
So maybe it's not just the staffing or being able to put people there, but that dispatching protocol will change that?
We are looking at it now to see if we can make that adjustment. There are some parts of COMAR that's involved with the medical director. The state has agreed to assist us with that, so we're working on that. So it's complex. So I think
Anything
that's all
else?
I have, unless you guys got some more questions.
Thank you, Mr. Walker. This is a difficult topic, and I think it's important to note that we all just want this to succeed, and we want to support our volunteer organizations, and we want their buy-in and them to support the
Agreed.
system as a whole, and I think we're getting closer and we're doing better. So thank you for your work with this.
Good statement. I agree with that.
I did have one more thing. I saw that on the medical billing, it's not really meeting up to demand or what we thought would be. How long do you think it takes to mature medical billing?
Well, some good news there, okay? And it is good news. So one of the things we've been waiting on is Medicaid. There's other insurance companies that are tied into that, so Blue Cross, Aetna, a few of the others, and you can't get the billing until Medicaid is approved. That was approved yesterday. We got the official word. If you take a look at the numbers again, we've billed out close to $1 million now. We've only pulled in 20,000. I can tell you that some of them, insurance companies are paying regularly. They're getting used to us billing. So it's starting to. It is much slower than we anticipated, and I'm pretty disappointed in that, but I'm hopeful right now that I think we're going to take a big push. We'll know within 30 days how this affects us, but this was the last stopping point. Medicaid, now that's been approved officially. I've got the letter. So I'm hoping that this begins to take us forward and do a lot better, so.
Well, I think it's reasonable to think any new program is going to take a while to catch on, get kinks
Agreed.
out of it, and get people used to what's expected of them or required of them, and hopefully that'll be within 6 months to a year.
I think so. I think within 6 months, we'll see it to really start to take off. Our staff on board that are working with us have gotten very good at dealing with it. They understand it very well, and I think we're going to start to move pretty good. So
Good.
I think the key, though, is to look at what the total to be collected is, whereas the projections are where we figured they would be, which is $884,574. So once those other mechanisms you have in place, I'm sure it'll hit the numbers that was set by staff,
Yeah.
and that's important. I
Yeah.
do want to say that the work of yourself, your department, the volunteers, the system in whole, it has led us to this success rate that we are now. And I just made this comment today, where we are far beyond the problems that were found in other systems that are dual systems. You've surpassed them. You got over the speed bumps. Everybody's got over them. So I appreciate that, because those other systems, they're going to be effective for many, many more years with that animosity. And I think that you're far above that. So
thank you very much.
One thing, too, is talking about Medicaid again. I'm on the Legislative Steering Committee for MACO. One of our, we've tailored down almost 30, we down to 4 areas of legislation. One of them is the billing area for Medicaid. And the problem with Medicaid is in the state of Maryland, of course, they're only paying $100 for transport. There's a bill in to try to get it doubled. But also, Medicaid will only cover transports to an emergency room only. And that's, we're going to push to have that changed, because most insurance companies follow under the Medicaid guideline of that particular state. So we got a problem in our state right now with Medicaid, and that's going to be one of the primary goals of our legislative committee. It's one of the 4 topics this coming year.
Well, that makes a lot of sense in why the Medicaid is blocking some of the other insurance companies. So that's actually a bit of helpful
Exactly,
information.
because they don't pay for, you go to somebody's house and maybe the guy's overdosed, you've dispatched it, and you give him a Narcan or whatever, and then you leave. You're not paid for that.
That is
Or you
correct.
take somebody to urgent care, drop them off, come back, you're not paid for that.
That's correct. That's
So
right.
anything they're paying for the emergency, that's part of the Medicaid problem we have in the state. they have said we only pay to the emergency room.
Right.
So we're trying to get that changed. That would be a big bill, and there's several delegates and senators that are pushing that bill also. So hopefully this coming year, we'll get some traction on it. It was in the bill last year too, but never got out of committee, if I understand. But I think this year we'll have some traction on it.
One last thing, Mr. President, I apologize. I had it written down. What is the status of DES reaching out to Senator Bailey's office in reference to the $200,000 bond that was created for the ambulance? That is an ambulance that can be accredited to the system while it's going to be dedicated to the Veterans Affairs. The state was looking for the avenues to have us participate in procuring that and possibly staffing it. This way, we would have another ambulance in the system.
So still working on it. The last information I received on it was that the volunteers and, in fact, the county personnel could not operate that ambulance. I'm working to verify that. In fact, when I walk out, I'll make a call to verify that. But that's the last information I received, is that cannot function the way we want it to function, where we could, actually put our personnel on there. I've been told that is not, and that was actually somebody from Mechanicsville volunteer, so.
Well, this is a state initiative at this point, so you don't have to go through them. This is state bond money to provide an ambulance for a state facility, which the state was planning on staffing with their own personnel. However, there's been some pitfalls with that, with retirements, various other things, and they were looking for us to handle the procurement process for the ambulance with the $200,000 and get that ambulance over there ready to go, which changes the dynamic. So Christina Vigorito, I'm going to butcher her last name.
I'm familiar with her.
Yeah, I'm sorry, Christina. She has more information on it.
I will call her when I walk across the street. So, okay.
Any other questions, Commissioner? No. Thank you, Mr. Walker. Good
Thank you all
presentation.
very
Thank you very
much.
much.
Thank you, Commissioners. And item E is from the Department of Human Resources with the 2021 Employee Satisfaction Survey results. Ms. Pratson presenting this afternoon.
Ms. Pratson, welcome.
We recently completed the 2021 Employee Satisfaction Survey, and today I'd like to review the results and present proposed responses. Beginning in 2013 and every 2 years following, the employees of St. Mary's County Government have had the opportunity to complete a satisfaction survey. This year, the survey was open for employee input through the month of September, through an online site and through paper survey submissions. 263 employees completed the survey, which represents a 7.4% decrease in participation from 2019.
Well, Ms. Pratson, that's probably one of the most disturbing numbers in here. Like, the results are not unexpected, but that drop in participation is disappointing, and I hope any of our employees listening will really participate next time, because this is important.
Thank you. I completely agree, and I think the survey itself, I think the background of the survey is COVID, and I think it just shows how difficult it is to communicate and engage employees when we're not seeing each other all the time.
Well, just for the public's edification, what is the total number of employees that we have? It's 800?
About 840.
So we're getting about a 33%?
Correct, yeah. And since the survey has begun in 2013, this is the only year that we've had a decrease. So every year we've shown increases. So we will continue to work on that. Thank you. And as you mentioned, the survey continues to reflect positive trends, with 82% of the respondents reporting that they are proud to work for St. Mary's County Government. Surveys were anonymous, and employees had the opportunity to provide written comments with their responses. And some takeaways from the survey includes passionate feelings about mask and vaccine mandates on both sides of the issue, with employees saying that, please imploring us to never have mandates, and others saying, what's taking you so long? Why don't you have mandates? So very similar to what we hear in the general public. And we have discussed with department heads, managers, that, mandates will be imposed if we're required to do so. And we are not required to do so to date.
So just a quick comment on that, just for the public's awareness too, because we've gotten, all the commissioners have received a lot of opinions on both sides of this, and people encouraging the mandates of vaccines for county staff. We receive weekly, as we get it from you, updates on COVID positive employees, just the numbers, and we're not seeing the spikes in county government employees. I think that is a testament to our employees, that they are educated, that they are handling themselves well, and they're doing a good job handling this.
Thank you for bringing that up. We have not, throughout the entire pandemic, we have really had great experience. And a lot of effort goes into workplace safety, a lot of effort goes into the protocols, and employees and departments have been very diligent. So thank you.
Yeah, definitely it's come up multiple times, but the fact that people are following policies, they're practicing safe distancing and, washing their hands, staying home if they're sick, those things are key. And it's not just recognized here, but I will tell you from the legit side of things, the Department of Human Resources and St. Mary's County and the policy has been recognized, your name in particular.
Thank you.
And that policy has been, the pandemic policy, which is a living document, which I know you helped craft, has been utilized by other governments. So it is, it's definitely a credit to your team and the staff, so thank you.
Well, thank you. And you've all approved nursing support through the grant, and that's been huge because our employees, our department heads contact the nurse when they feel like they've been exposed, when they're sick, and she can help walk them through if they need to test, if they need to quarantine, and that's been an enormous assistance.
Okay.
So thank you. Telework. So telework is another pandemic-related issue that was frequently mentioned in the survey. And there's a lot of dissatisfaction among employees who cannot telework. For those who can, employees feel that they are picking up the slack while others are out of the office teleworking. So Dr. Bridget and I have talked at length about that. We've discussed it with department heads. And you mentioned the pandemic policy. The response that we propose is that in this level 2 pandemic response, which is where we are, that we would only authorize no more than 50% of an employee's scheduled hours for telework. And if somebody requests and needs telework more than that it would be handled as an ADA request. And we would go through that process of medical documentation and whether it meets the ADA criteria.
Well, that's interesting. Tell me, what makes the criteria for someone to say, I'm teleworking and I got to go in? Is there something that we put out to our employees that said, this requires you to show up every day?
So you may recall, in the height of the pandemic, we were required to leave, and anyone who had to did. And now that we're in pandemic level 2, it's been a department head decision. So it really has been up to the department head to manage within their department. And some employees have not been back. Some employees continually telework.
Or that's at the approval of the department head?
It is. It is, but I think that maybe what has been unrecognized is how other members of that department may be impacted.
I mean, I guess my thought process would be if someone's like doing road work or something like that, or that person's needed, versus somebody else in that same department could be teleworking from home and they feel it's not fair to them? Is that what you're talking about?
I do. I think that people who are in particularly office settings, people who are in offices, greeting, answering doors, answering phones, feel like the people who are working from home, don't have to manage that.
Okay.
Interruptions, those kind of things. So, and it's challenging for departments that are blended, that are not just administrative, because there are, as you mentioned, there are some employees who cannot telework because of the nature of their job.
Okay.
Ms. Prattson, I have to recognize that resentment is real.
Right.
It's not just in our government here, but it's in every place, whether it's private sector or government, but I can tell you for sure, I know it is shared among other governments. Then you have the other nexus of the public safety, public health.
Right, right.
Teleworking, so it's hard to manage, and I appreciate you taking the step to try and curb some of that by managing the office flow with the 50%, because that's still there. It still gives the department head some autonomy, and it's still, obviously, they're doing the right thing. So our transmission rate is low, and we're doing very well as far as county government's concerned, so I do that.
And we have some departments that don't telework at all,
Right.
because of the nature of their work, even though they potentially could. And I know, for example, in Human Resources, we can all telework one day if we wish, and many of the employees don't want to because we're so busy. It's just easier to be in the office. So, I think it's this 50% would allow for flexibility. And then if it's more than the 50%, I think it really has to be handled as an accommodation and more thoughtfully discussed.
And the other side of it, too, is the work-life balance is a lot more difficult when teleworking. And
Yeah.
having been on mandatory telework for a while, it's
Right.
a lot easier to check your work emails in the evening, and it's hard to keep that separation, so.
And we struggle with that sense of camaraderie and teamwork, and as we talked about with the response to the survey, just engagement. But yet, with recruitment, I think particularly younger employees expect that flexibility. So how can we manage all of it in both and do it well?
Well, elaborate a little bit on this part about if it'll have to be some kind of an accommodation.
Yes.
Does that mean they'll have to show that they're physically unable to come in, or there's some reason why they can't, they're whatever that compromise word is?
Yes, yep. So it would be handled, so, for years, we've offered that. So if somebody needs an accommodation, we go through an entire process that requires medical certification. The litmus test is, can we accommodate you and you still can perform the essential functions of your job?
At work?
So that is the deciding factor.
Okay.
Can you perform your job with 100% telework, for example?
Okay. All right, thank you.
Sure. Smoking. So there are a lot of comments about tobacco use, and we have reminded department heads and directors that the county is tobacco-free and that we all have the requirement to enforce current policy.
Have we got rid of any of the remaining, whatever they're called, butt cans and whatever they are on campus at this point?
Been removed, yeah.
Okay.
Although I did hear that one reappeared by the STS bus stop, but that has since been removed again. So,
Now, do we have a policy that allows people to, say, I'm entitled to go smoke a cigarette twice an hour? I mean, I just don't know what the...
we
So
don't,
if someone wants to take a smoke break, they just say, I'm taking a smoke break, and they go?
and that would depend, I think, on their department. But yes, there is no requirement to provide breaks.
I think I mentioned to you that we talked about people in private industry where a private contractor had that opportunity, and someone says, well, I'm going to go out, I don't smoke, but I'm going out with them.
Right.
And someone come out and said, look, you're not smoking, you should be in the office working. And his point was, well, look,
Right.
they're out here, why can't I be out here? It's kind of a double-edged sword there. It's a tough one to call.
It is. And a little bit of the thinking is you make it difficult, maybe people won't take them.
What's that now?
You make the breaks difficult and maybe people won't take them.
Or at least as many, right?
Right, or smoke.
How do you make them difficult?
I know, just that they can't be on campus.
So they got to drive away?
Or, well, people
Walk away?
People are walking over to the state building is what they're doing.
Oh, goodness.
Yeah.
If they're going too long, you just...
What do you do?
dock them
Dock-
leave
dock
time.
them from work?
You dock them leave time.
Which state building?
They take...
Carter
Court building, of course, they're in
District
back.
Court. Yeah.
Yeah, but that's still on campus, so
Their property.
Yeah, it's not our
State property, not
property.
Belongs to the state?
Still, someone gone 15, 20 minutes to do a smoke break. I mean, is that fair to the person who's in the office working that doesn't smoke?
I don't think so, and I think it's the resentment for the telework. I think it's the same issue, right?
Okay.
I think you should look into that one, because I think the way the policy is written, it's on campus, and whether that's state property or not, it still falls within the governmental center campus as a whole. I think you should look into that one.
Okay.
Well, I
Please.
think it goes to whether it's an addiction or not. You know, I mean, hey, look, I'm having this nicotine fit
Yeah.
kind of thing, and
Yep.
therefore I have to go out there and satisfy this addiction. It's just an interesting topic for you to have to deal with.
Oh, totally agree, and that's where the wellness comes in, right? And providing support so people can quit and change and make better choices. So, some employees expressed excitement for growth in various departments. Others expressed concern about being short-staffed with our vacancies. And we currently have about 52 openings.
We have 52 vacancies.
Do we have applications?
We do. Not as many as we used to, but we do. And one of the things that we're experiencing is we'll make an offer, and someone will say, can I get back to you in a week? And you can tell that they're waiting for other offers, and they're juggling. So,
Well, the whole labor market, as we well know, is tight. So whether applying for a job here as a contractor working on the base, it's a very open marketplace now with not a lot of people applying. How's that?
and I think therefore that telework, I think we have to have the flexibility. We just have to manage it, because I think many employees expect that now.
Welcome to the New World Order, right?
I know. Ready or not? Compensation. So compensation came up. Concerns that we're not keeping up with cost of living in St. Mary's County, not competitive with Pax River, and not maintaining pay parity with the state police and Charles County Sheriff's Office in particular. So, and then gratitude. Employees express gratitude that they were able to retain their jobs and continue working throughout the pandemic. And kudos to our departments, because even hourly employees who potentially were at senior centers, for example, and would have been laid off, we maintained their work and we reassigned them. So we did a really good job keeping people employed. And the survey results have been presented to you both in summary and in full, and then they'll be posted today after today's presentation for all of our employees.
Very good. Any other questions, Commissioner?
No, thank you very much.
Yeah.
Thank you very much. Thank you very much for the
Oh,
survey.
thank you, and really appreciate the feedback and the comments.
Also, Commissioners, if you didn't do the survey, you can do it.
Multiple times.
You're an FTE, you could have responded if you didn't. All right.
I think it's more important for the full-time real employees to worry about the commissioners.
I did it strongly. I was happy.
Any and all, right?
Happy.
Absolutely. Thank you very much.
Thank you.
Okay.
Thank you, Commissioners, and this completes County Administrator time.
Okay, so next thing we don't have is we got
We have a break.
the MDOT 2.
Take a break till MDOT.
Let's take let's take a break until 2. Be back at 2. No.
Sure.
Go too far now.
Thank you.